Welcome to part 2 of nursing practice questions and answers about respiratory problems of the adult gland. Now let's start with the first question. The nurse is caring for a gland after a bronchoscopy and biopsy. Which finding, if noted in the gland, would the nurse immediately report to the primary healthcare provider? These are the options. Option A, dry cough. Option B, hematuria. Option C, bronchospasm. Option D, blood streaked sputum. Now for this question, the correct answer is option C, bronchospasm. Now let's move to the rationale. If a biopsy was performed during a bronchoscopy, blood streaked sputum is expected for several hours. Frank blood indicates hemorrhage. A dry cough may be expected. The gland needs to be assessed for signs of complication, which will indicate cyanosis, dyspnea, stridor, bronchospasm, hypotension, tachycardia, and dysrhythmia. Finally, hematuria is unrelated to this procedure. Now let's move to the second question. The nurse is assessing the respiratory status of a client who has suffered a fractured rib. The nurse will expect to note which finding. So these are the options. Option A, slow, deep respirations. Option B, rapid, deep respirations. Option C, paradoxical respirations. Option D, pain, especially with inspiration. The correct answer for this question is option D, pain, especially with inspiration. Now let's move to the rationale. Rib fractures result from a blunt injury or a fall. Typical signs and symptoms include shallow respirations, splinting, or guarding the chest protectively to minimize chest movement, pain and tenderness localized at the fracture site that is exacerbated by inspiration and palpation, and possible bruising at the fracture site. Paradoxical respirations are seen with the flared chest. Now let's move to the third question. A client with a chest injury has suffered flared chest. The nurse assesses the client for which most distinctive sign of flared chest. So these are the options. Option A, cyanosis. Option B, hypotension. Option C, paradoxical chest movement. Option D, dyspnea, especially on exhalation. Now, the correct answer for this question is option C, paradoxical chest movement. Now let's move to the rationale. Flared chest results from multiple rib fractures. This results in a floating section of ribs because this section is untouched to the rest of the bony rib cage. This segment results in paradoxical chest movement. This means that the force of inspiration pulls the fracture segment inward while the rest of the chest expands. Similarly, during exhalation, the segment balloons outward while the rest of the chest moves inward. This is a characteristic sign of flared chest. Now, in my presentation, my reference book have used Saunders Comprehensive Review for the NCLEX RN examination ninth edition.